This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please remain muted until it's time to ask your question. If you're on the phone and are able to do so, please use *6 to mute and unmute. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Diseases, Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor, and Deb Standridge, the Chief Executive Officer of the Alternate Care Facility. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks again for joining us. As we continue to fight the COVID-19 pandemic and its many effects on the health and safety of Wisconsinites, we also need to keep in mind how these challenges are affecting workers in Wisconsin and their families and our state's economic recovery. Earlier this week, we announced a new partnership between DWD and Google Cloud to help our state process unemployment insurance claims and pandemic unemployment assistance claims more efficiently. And today we have another encouraging update out of the Department of Workforce Development. The DWD began releasing lost wages assistance benefits last Thursday and will continue to make payments over the next week. The Lost Wages Assistance Program is a FEMA program that provides an additional $300 per week to eligible folks who certify that they were unemployed or partially unemployed due to the pandemic. This $300 a week in additional support can help families and individuals make ends meet as we continue to navigate these times, and it's estimated this will total another roughly $224 million into the hands of up to 220,000 claimants. As I've said before, there isn't a worker or a family or an industry that hasn't felt the effects of this pandemic, and that includes Wisconsin's tourism industry, which was a $22 billion industry in 2019. That's why, as part of our major investments in small businesses and economic stabilization, we also invested nearly $12 million in providing support through our travel grant program. And this week, we announced that travel grants have been awarded to 158 grantees to help Wisconsin's tourism promotion and development organizations resume business operations and restore economic activity. Tourism plays an important role in Wisconsin's economy, and we're glad that the travel grants can provide some much-needed relief as the tourism industry and, frankly, our entire state works towards recovery. This week also marked the beginning of in-person early absentee voting in the state of Wisconsin, and we've seen amazing turnout so far. On Tuesday, the first day of early in-person voting, folks from Eau Claire to Milwaukee to Stevens Point turned out to vote with nearly 80,000 Wisconsinites early voting in person. We also passed the 1 million mark for absentee votes cast either by mail or in person. Now that's great news, Wisconsin, and I expect those numbers will continue to grow over the next 2 weeks. So this is your reminder that you don't have to wait until November 3rd to vote. Voting early can also help your local clerk crowds, but by allowing them to start counting ballots right away on Election Day. If you have your absentee ballot, make sure to get it in the mail as soon as possible. Drop it off at an official drop box or at your early voting locations in your neighborhood. If you want to vote in person, you can find the hours and locations for your local municipality by visiting myvote.wi.gov or by contacting your local clerk's office. Our clerks are doing great work, and they work tirelessly in every corner of the state to ensure that we have a successful election. They've adapted to the challenges brought on by the pandemic while also following state law and adopting when things change. So when you go to vote, you need to bring your photo ID, but then make sure you're helping keep other voters, our clerks, and our poll workers safe by bringing your mask, some hand sanitizer, and even your own black or blue pen if you can. If you need to learn more about what's on your ballot, check your voter registration or find your polling place. Again, visit myvote.wi.gov. Finally, I'll close today on an unfortunately somber note. Secretary-designee Palm will provide today's updated numbers in just a moment, but as of yesterday, 1,681 Wisconsinites have lost the battle against this virus, with 48 Wisconsin lives lost yesterday alone. This was the highest single-day number of deaths in the state of Wisconsin. Kathy and I send our deepest condolences to their families, their friends, their loved ones, and our thoughts are with the 182,687 who are still struggling with a positive COVID-19 test result, and the many Wisconsinites who have been hospitalized in the last few days. We've seen high levels of COVID-19 hospitalizations, with some regions reporting over 90% of their ICU beds in use. Wisconsin continues to see high levels of COVID-19 hospitalizations, with some regions reporting over 90% utilization of ICU beds. We also admitted our first patient to the alternate care facility at State Fair Park yesterday. And to those who say this pandemic has been blown out of proportion or that there isn't a real risk, folks, they're just flat out wrong. Wisconsinites in every corner of our state have experienced this virus firsthand. Families have lost loved ones. They've lost mothers, fathers, sisters, brothers, grandparents, and best friends. And our nurses, healthcare staff, and physicians are working long, frankly, emotionally exhausting hours on the front lines, caring for COVID patients and putting their own health and safety on the line. Make no mistake about this. This is an urgent crisis. If this weren't absolutely serious and if this wasn't an emergency, I wouldn't be sitting here twice a week asking you to stay home, physically distance, and wear a face covering whenever you're out. Right now, we need to listen to the public health experts, and we need to believe in science, not deny it. The best thing we can do for our COVID-positive neighbors, friends, and family is to stay home, wear a mask, and continue to take every precaution to stop the spread of this virus and look out for one another. With that, I'll now turn things over to Secretary-designee Andrea Palm for her update. Andrea, take it away.
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. I'll start with the numbers again because they really do underscore what the governor just talked about and the severity of the situation here in our state. There are now 186,100 confirmed cases of COVID-19 in Wisconsin. That's an increase of 3,413 over yesterday. Our 7-day average of new cases is 3,396. 1 month ago, that number was 1,838, and 2 months ago, it was 707. We've now lost 1,703 Wisconsinites to COVID-19, an increase of 22 over yesterday. In mid-September, Wisconsin had 15 counties that were at very high COVID activity level. 5 weeks later, 68 of our 72 counties are above the very high threshold of at least 350 people infected with COVID-19 for every 100,000 residents. In fact, the case burden in some of our counties are 5, 6, and even 8 times higher than that threshold. COVID-19 is everywhere in our state, and it's still spreading. When activity level is this high and the trajectory of our cases is growing, gatherings of any size are not safe. Interacting with people outside of your household can easily spread the virus, and once the chain of transmission starts, it can lead to serious infections and hospitalizations across our communities. Across the state, COVID-19 hospitalizations have increased 22% this week compared to last week. In the Northwest region, that increase is much higher at 52%. The number of COVID-19 patients in the ICU is also much higher than before. Across Wisconsin, we have seen an increase of almost 21%. In 2 regions, that increase is 50% or higher. A week after opening the alternate care facility, we admitted our first patient yesterday, and we have 1 patient there today. These are stark numbers, and with our current surge in cases, our hospital numbers are going to get worse before they get better. We must take action immediately to stop transmission and get Wisconsin moving in the right direction again. Please stay home. Limit your interactions with people to only the people that you live with. Wear a mask. Physically distance, wash your hands, get tested if you have symptoms or have been exposed to COVID-19. Notify your contacts and quarantine as you wait for your results and self-isolate if you test positive. To ensure that everyone who needs a test can get a test, DHS is partnering with the Wisconsin National Guard and local and tribal health departments to expand testing access to 70 new sites around the state. So please, if you need a test, get a test. You can find testing sites in your community by going to dhs.wisconsin.gov and clicking on the link that says Community Testing Site. With your help, we can stop the spread, save lives, and get Wisconsin through this crisis. Thank you.
Thank you. And we'll now take your questions. A reminder to maintain audio quality, to stay muted until it's time to ask your question. And we'll begin today with Matt Jarko from NBC 26 in Green Bay. Matt.
Yes, thanks for taking the call. This is John filling in for Matt. We're wondering, today in Green Bay, a local hospital began testing anyone with or without symptoms for COVID-19. They said this was in part due to resources provided through the state health department. Can you tell us, is this a key to slowing the spread of the virus, and should we expect more resources like this to be made available?
So I'll ask Dr. Westergaard to dig into the details, but obviously our community testing program and the increased access we're trying to provide around the state with these new sites really is about understanding where the disease is, right? It is the way we start to be able to take public health action to stop the spread. Who is positive? And testing is the way you find out the answer to that question. And so we do think it's really important for folks who need a test to get a test, and we really are anxious for folks to check out where their community testing sites are in their communities and get a test if they need one. But Dr. Westergaard, you may want to speak to the asymptomatic part of that.
Sure. I think it's very likely that the majority of new cases in the state are the result of transmission from someone that doesn't have symptoms. So that's a really important thing for people to understand about this virus. It's different than most other diseases. Most of the time, someone who has symptoms is the source of most infections. Now, it's true with this virus that if people have symptoms, they are more highly infectious. But the fact that so many people can be infected without symptoms, and the fact that there's so many of them puts that at really the highest priority of stemming the tide of new infections. So yes, the highest priority for testing people are with those with symptoms, because we need to get them out of contact with those. The second tier is people who have been exposed. So a household member of someone who has been tested positive, regardless of symptoms, should be tested as soon as they can. But in this environment where the virus is spreading silently throughout the whole state, we're not going to make a dent unless we test people without symptoms. We need to develop strategies to do that in a coordinated way. But right now, it's inappropriate, in my view, for anyone to get turned away from a test because they're concerned that they've been exposed, even if they haven't been identified by a contact tracer as having been exposed. That's the situation where we are now. This virus is spreading silently. We have to presume that it's everywhere, and anyone that has access to a test should get a test.
Thank you, Matt, or John. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
I wanted to ask a question about contact tracers. Dane County is kind of telling us as of yesterday they no longer can guarantee a contact tracer will be able to reach out to people who are positive. And so I'm just wondering if there still is an effort to get more contact tracers or if we're beyond that point, and what the current contact tracers are doing. Are they still interviewing cases that they had already been interviewing, or are they moving on to other duties?
Yeah, thanks, Danny. And again, Dr. Westergaard may want to dig in here a little bit, but I would say we at the state, let me step back and acknowledge that the public health infrastructure in the state of Wisconsin, when it comes to contact tracing, is beyond its capacity. What Dane County announced yesterday and what we're hearing certainly from other local public health departments is that they cannot keep up with their new daily positive cases as it relates to being able to effectively do contact tracing. It speaks really urgently to the need for all of us to take the actions together that are necessary to stop the spread, to take that pressure off the local public health infrastructure so we can get back to a place where we can contact trace in a more effective way. In answer specifically to your contact tracing question, we do continue to expand our workforce at the state level. Right, we took on the role in partnership with local public health to provide surge contact tracing capacity. We now sit at the state at 285 contact tracers. We will have an additional 47 that will start on Monday. We'll go through their training and be able to get on the phones and get in the mix on contact tracing after that. As we drive at the state towards a number of about 400 contact tracers. But again, we've got to get to a place where our daily new positive cases is not overwhelming the system, because right on the front end, it overwhelms the public health infrastructure and their ability to do contact tracing. The lagging indicators are our hospitalizations and deaths. And so until we see new daily cases go down and we start to take that pressure off local public health, it is not going to carry forward into reduced hospitalizations and deaths. And so we've got to do this work now. We've got to do it together so that all of our systems, our public health system, our healthcare system, can handle this pandemic and keep us all as healthy and safe as is possible. Did you want to say any more, Dr.
Well, I think one piece in there I'd pick up is that, like, are we past that? Are we beyond the point where contact tracing is useful? And I think the answer to that is very clearly no. And again, there's two types of contacting or interviews that contact tracers do. There are the case interviews, so everyone who tests positive gets called by a contact tracer, and they ask the questions: who have you been in contact with, and where, and what sort of gatherings have you been to? So that's a standard that we need to continue forever, because those people need support and they need advice and recommendations. The second piece that contact tracers do is all of the contacts that are identified through those interviews ideally will get contacted and notified by public health to tell them what they need to know. That's the piece where we're not able to keep up. And so there are ways that we can do that. We can educate the public about what it means to have been exposed, the need to quarantine. We can engage with cases when their families to the extent that they're able to notify their contacts. So in any of those cases, I don't think think it'll ever stop being beneficial to give people the advice that they need to quarantine, meaning stay out of contact with others if they've been exposed to the virus. We just right now don't have the resources to specifically call every person who's been exposed. I think it's a good goal to get back to that point, but as the Secretary said, we're not going to get back there until we really turn the curve and stop the wave of new infections.
Thank you, Danny. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hello, my question is for Governor Evers. You had said that you wouldn't be doing these briefings twice a week if this wasn't an urgent crisis, and yet, as you guys have noted, we keep seeing these new records almost every day or every week. First of all, why do you think your message isn't resonating with all Wisconsinites? And follow-up question, is it time to change your message, perhaps focusing more so on people who aren't symptomatic? You know, for example, should everyone at this point just assume they have the virus? Thank you.
Sure. And, you know, at the end of the day, all of this is around individual responsibility. You know, we can do the orders, and that sets the stage and sends a message to the people of Wisconsin that, you know, right now we have an order around face coverings. That sends a message to the people of the state of Wisconsin. That's an important thing. Wear a mask. Second of all, we have an order out there that limits public gatherings. The message around that is don't go out and hang out with a bunch of people, especially in small spaces where you can't socially distance. So we will continue to do that. But at the end of the day, it has to be around individual responsibility. You know, we talk about who's going to be policing this effort. Every person in Wisconsin is policing this effort. This is not something, you know, I'm hopeful that police departments will, if they see something wrong, they'll remind people of their obligations to their neighbors around being safe. But at the end of the day, we are sending the message that you have to mask up, you have to have facial covering, and you have to be careful about public gatherings. Now, you know, and I talk about this every week, and I'll continue talking about it. When we have inconsistent messages from our leaders, whether they're local or state or national, that's a problem. People do listen to leaders. Now, I'd say at this point in time, because of what I see every time we have a order, we end up in court, and Republicans or their allies are part of that effort. That's a problem. That sends a message to the people of Wisconsin that Republicans don't care about this. I don't believe that for a minute. I know Republicans that do wear masks. I've seen the speaker wearing a mask. So the idea that somehow Republicans are, you know, I'm sure there's some, I read, but for the most part, I think it is a bipartisan effort. They do want you to be safe. They do want you to stay healthy. They do want you to have face coverings. They do want you to make sure that you're not hanging out with a bunch of people in a small room with nobody wearing a mask. I'm just hopeful that, because I believe it, I know Republicans that feel that way. I see the actions of some Republicans. I encourage them to speak up too. This is not a one-man band here. This is an important issue in the state of Wisconsin. We have well over 3,000 deaths, cases this last 7 or 8 days. You know, you think about preventable deaths. Let's just do the math here. I'd say on the low side, 1% of people that are identified as COVID-19 die. Yeah, it's not just under that number. So think of 3,500. There's 35 people out of that group on average that will not be here. Come on, folks. Let's all get together. It's individual responsibility. This is not a political statement.
Thank you, Madeline. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks so much for taking my question. My question is for the public health leaders here. Is there any evidence whatsoever that any of the mitigation strategies that public health is currently performing in the state, between the mask mandate, the gathering mandate, is there any evidence whatsoever that any of it is working? Thank you.
Yeah, Rob, I'll let Dr. Westergaard dig in a little here. I think one of the things we've talked about throughout this pandemic is the lessons we've learned from watching folks around the globe as well as states around the U.S. And I think one thing that is certainly very clear when you look at the surges that happened in the South and in other parts of the state in the months preceding the current situation that we are in, there's not a state whose hospitals were filling up the way ours are filling up that did not take mitigation strategies similar to and exceeding the ones that we have taken here in the state of Wisconsin. There's no doubt that the way you stop the spread of this virus is by reducing contact between people. The way you do that is through wearing a mask, through physical distancing, through not gathering with people outside of your home. These are tried and true, tested and proven public health interventions, and states across this country and countries around the world have used them to bring their outbreaks under control, and it is what we need to do here in the state of Wisconsin.
So I think there's a couple ways to answer that question. One is there evidence that the strategies are effective? And the evidence is very strong. And we review that scientific literature about the effect of face masks on reducing transmission, the effect of physical distancing of greater than 6 feet. So the science is very clear that those are the determinants that decide whether a person with the virus spreads it to the other. I don't think that's what you were asking, though. I think you were asking, are the policies and the messages that we've done to try to implement this strategy working? And I think it's a fair question, but I think the evidence is overwhelming that they have. What we know about the virus in terms of how quickly it spreads through a population if we do nothing is that it's very rapid, and a large proportion of the people will become exposed in a relatively short period of time. We saw that in the first several weeks in the city of Wuhan in China. We saw that in April in New York City. So left to its own devices, we could have 10 times more cases and more deaths than we have right now. In fact, that's what would be expected if we didn't do infection prevention like we're doing. So the strategy that we've done, and so I think that's important for us to, the whole state, not just public health, but to acknowledge what we've accomplished. Knowing what we know about this virus, it could have been dramatically worse, 10, 20 times worse than it is. The only reason it's not is because we have done the things that the evidence shows reduces transmission. And that's face coverings in public, keeping gatherings small, hand washing, isolation, quarantine, and scaling up testing. So yes, I'd say strongly the evidence suggests that what we've been doing has made a very large difference.
Thank you, Rob. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell.
Yeah, thank you very much for the call today. Governor, it's been about a week since you asked Republican leaders to meet on COVID-19 measures, 2 weeks since they sent a similar request to you. I was just wondering if you could talk a little bit about where everything stands with that meeting. Has anything been scheduled? And if not, do you have any sense of what the holdup is? Thank you.
Yeah, and we have not heard, but clearly I think both leaders do want to meet at some point in time. I'm guessing the national election is playing a role in that, but I have not heard, and I'm waiting for them to put some plans in place that on paper so that we can talk about that. But to answer your question directly, no, I have not received a letter to my knowledge.
Thank you, Mitchell. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there. Thanks for taking this question. So my question is for Governor Evers, more about this, bipartisan. You said you want to make a bipartisan effort to help reduce the spread of the virus. So where's the disconnect, and what's the solution to get everybody on the same page?
Great question. We've been trying to be on the same page for some time. Hopefully, at some point in time in the near future, we'll sit down with the Republican leaders and determine whether those mitigation strategies that we know work. And I'll repeat them again: facial coverings, making sure that you're socially distant, and be concerned about public gatherings. What can we do together on that, and whether it's something legislatively or not? But we have to have folks understand how important this is, and that if their caucus is not on board with facial coverings and social distancing, then there won't be any in agreement.
Thank you, Katrina. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi. Thank you for holding this. I was wondering for the surge facility in West Allis, have there been any changes in its criteria for accepting patients so that higher acuity patients are being accepted? Can you elaborate on whether or not you're looking to make changes to allow higher acuity patients? Thank you.
Yeah. Thanks, John. I'm going to ask Deb Standridge to weigh in here. I would say broadly that this alternate care facility is designed to be a backstop for our hospitals across the state, and we are in constant conversations with them about how we move through this together. And so I know Deb and her team have been having a lot of conversations with them specific to your question, and so I will ask her to weigh in on that if she would.
Thank you, Secretary Palm. You're absolutely correct. Daily, we have conversations with our healthcare partners about how we can integrate with them in helping serve the patients in our community. We have made changes based on the feedback we have received from the healthcare facilities. For example, we now are able to administer remdesivir to patients. And I've got to thank the Department of Health Services and the Department of Administration, who wrote an appeal to the FDA to include alternate care facilities in the regulation in terms of facilities that can administer this very important drug. And within 36 hours, the FDA came through and gave the ability for alternate care facilities across the United States to be able to do that. That was a game changer for our healthcare facilities because there are several patients on this drug. We listened to our healthcare partners and we responded with the help of Department of Administration, Department of Health Services. We have looked at other areas in terms of age criteria, in terms of patients in the emergency department, and we've made changes to our criteria based on that. So we are flexible, we are nimble, and we are responding to the needs that our healthcare partners are asking of us.
Thank you, Sean. Now to Mason Dowling from WAOW-TV in Wausau. Mason.
Hi, my question is for DHS and health officials. We just had a presser earlier today with Aspirus Health Systems, one of several hospital groups here in central Wisconsin, that says the virus is starting to impact their employees as well. Are you hearing more reports of hospital systems saying that now their, doctors, nurses, healthcare workers are starting to feel the effects of the virus and caring for all those affected as well?
Yeah, so it certainly is one of the implications of community spread at the level and intensity that we're seeing it around the state of Wisconsin, because at that kind of widespread community transmission, your healthcare workers and other employees in those settings leave work and they go out into that community to do their shopping and their other essential errands, and either can be infected with COVID or can be in contact with someone who is. And those folks can't, they can't come to work. They need to quarantine. They need to get tested. They need to do the things that are necessary to make sure that they are healthy and well. And so that certainly is something that is impacting our hospitals and nursing homes' ability to remain fully staffed. And so, our capacity in those systems is not just the sheer number of beds, but it is adequate staff to appropriately staff those beds. And so it's a really important part of how we maintain the capacity of our healthcare system. It is why we talked back in March and April about needing to flatten the curve to protect our frontline healthcare workers and hospital systems. It is that piece of their potential infection and need to quarantine and therefore getting pulled out of the workforce as they await their results and understand their health before they can go back to work. So the deployment of rapid testing is something we have been doing for hospitals thanks to some assets that the federal government has provided to us to help do, again, rapid testing to get those folks who can back into the workforce as quickly as possible. We've done a number of things on the regulatory side to improve flexibilities for our hospital systems, including allowing out-of-state licensed providers to fill those gaps. We have a volunteer system that we call Weaver, where folks who are licensed providers can register with the system and be available to volunteer so that they can fill short-term gaps in staffing needs. We also, when it's necessary and appropriate, can make staffing requests to FEMA if it gets to that point as well. But we are pulling all the levers that we can because, again, our bed capacity, our capacity in our hospital systems is not just about beds, it's about adequate staff to provide that care. So it's a really important piece of this and something we're very focused on.
Thank you, Mason. Now to Katie Anderson from WBAY TV in Green Bay. Katie? Katie Anderson from WBAY. Okay, we'll move on then to Stephanie Hoff from WIS Politics. Stephanie?
Good afternoon. My question is for the governor. So we're about 2 weeks into the capacity limitations, one incubation period for the virus. Will you extend the order because cases are not going down?
Well, it's certainly something we're looking at. Never say never in this business. We'll do whatever we can to protect the people of Wisconsin. But yes, that order was based upon 2 incubation periods, and we're getting close to the end. So anything is on the table, but no decisions have been made yet.
You, Stephanie. Now to Todd Richmond from the Associated Press. Todd?
Hi, can you hear me?
Yes.
I just wanted to circle back to the questions earlier about the messaging. I mean, clearly you've been delivering the same message now since March. Clearly it's fallen on far too many deaf ears across the state. It's ineffective. And what is your plan B? Or is the plan just to continue to tell people to mask up and watch them ignore it? Or is there no plan B? What is the different tactic here? How can you change tactics?
Well, first of all, as you heard before, Todd, that we believe that the orders have made a difference. It would be worse without them. And frankly, the science is all about the things we're talking about. I just can't make up crap out of thin air here. So we will continue to have that conversation around the things that we know work. So we're looking at a number of people that are not complying. 70-some% in the state indicate they support face coverings. So I can assume that at least or about that number, maybe a little less, maybe a little more, are complying. And so we will be working on that 20%. And frankly, I believe having our communicator in chief, President of the United States, could help in this arena. Clearly, he keeps talking about us turning the corner. Everything's going to be good by Christmas. I heard that about Easter. And so there is a belief, I think, on most part of this country that the president thinks this isn't a big deal. Well, as I just said before, out of the 3,000 that that we identified today as positive, 1% or maybe a little less are going to die. I just can't believe that is turning the corner. That's not turning the corner. So we need consistent communication from our leaders, and we're not getting it. So I will continue to work on that angle. If some new science comes up and I don't have to make up stuff out of thin air to get people to do it, we will certainly advocate for new science. But at the end of the day, the things we're talking about now are still important. We just need the leadership, a uniform leadership effort to communicate that.
Thank you, Todd. Now to Lane Kimball from News 3 Now in Madison. Lane? Lane Kimball, WISC. Okay, we'll move on then to Heather Poltrock from WSAW in Wausau. Heather.
Hello. Some people who've been diagnosed with COVID-19 are continuing to see health impacts quite a few months later. And we've talked with a few individuals who have not been cleared to go back to work because of that. And doctors really don't have good treatment for them. So can you share, are there any plans for, so statewide, or in terms of how many people are getting these longer lasting impacts, what hope is there for treatment and what can help these people get back to work?
Thank you for raising that. It's definitely true. We've observed that people can feel quite lousy for a long time, even after they've been through the 10-day period that we think they are infectious. So what's behind that is, the virus causes an acute illness, causes the fever and the runny nose and the cough. But then there's a whole range of other kinds of damage mediated by the immune system and other things that we don't fully understand that can cause damage to the body that takes a long time to heal. So it is quite common for people to continue to have symptoms for some time. The best science indicates that even among those patients, as long as their fever has gone away and they have, by all accounts, a normal immune system, they don't remain contagious for more than 10 days. So people can generally return to work after they meet that 10-day window for discontinuation of isolation, even if their symptoms haven't resolved. And there's a lot of additional research about treatments and actually just understanding of why people tend to feel so poorly for as long as they do. But that doesn't have a huge impact on when people are able to return to work from an infection control perspective. They may not feel well enough to go back to work, but what we know about the virus in terms of how it spreads, most people are no longer infectious after 10 days.
Thank you, Heather. Now to Mayan Silver from Milwaukee Public Radio. Mayan?
Hi, sorry about that. I'm here. Thank you so much. I was wondering, we've been hearing that President Trump is going to come again to Wisconsin this weekend. I'm not sure if that's been completely confirmed. Do you have any evidence? Like, what's your reaction to that for Governor Evers? And do you have any evidence in terms of for the public health officials of these events being spreaders or super spreaders?
Well, my response is twofold. One is, as you know, even though they're outdoors for the most part, those events have people sitting shoulder to shoulder, talking to each other, yelling, screaming, dancing, without masks. And so that's just not where I believe we need to be as far as sending a message. And then we have the president essentially saying, we're rounded the corner, things are fine, da-da-da. So, I can't control his political message, even though it's dead wrong. But he should, I know he has the ability to set parameters for his audience. And I would expect him to do that. Not just hand out masks, not just say wear them, but he should essentially say, if you're not wearing a mask and you're not sitting 6 feet apart, don't come. I mean, that should be his message. Do I think that's going to happen? Absolutely not. There's no data to support that. There's no information in my worldview that says that he's been doing that. So it'll be a disappointment because he's not following science, but not a surprise.
Thank you, Man. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo.
Hi, thanks for taking this call again. This may be a question more so for Secretary-designee Palm or for Ms. Deb Standridge. Regarding the alternate care facility, I think it's the Wisconsin Hospital Association yesterday told us that it's been tough to get patients to go there to receive care rather than at the hospital. I'm just curious to hear, do you guys see that as a challenge, as a concern? Do you think, as far as addressing the current strain on healthcare systems?
Yeah, Deb, I'll let you take that as you've been having conversations with the hospitals.
It's a great question. None of us have been through a pandemic. And presenting the option of going to an alternate care facility to a patient is a brand new patient care model. It's not their neighborhood hospital that they're used to going to for when they're ill, but also when they're healthy. So it's having that conversation because they ask, well, what does this mean? Is it like a hospital? Do they have licensed healthcare professionals? That's why we put together a brochure that the caregivers can give to the patient at their bedside. We also have been able to have, when the caregivers ask us to, have conversations with patient families. I've had conversations with patient families who have been considering coming here in terms of assuring them this is we have licensed care professionals, we have licensed RNs, we have respiratory therapists, etc. We are an alternative to continuing your care that you're now receiving in a hospital. But this is brand new. It's unique. It's unknown to the patient. And those continual conversations we need to have with patients and families during this unprecedented time is what's occurring right now, familiarizing them with this brand new model that is in place in Wisconsin.
Sophie Carson from USA Today Network, Wisconsin. Sophie?
Hi, thanks for the call today. My question is following up on a Washington Post story that came out a few days ago that almost 300,000 Americans, more have died this year than previous years due to COVID, but also other causes of death. In Wisconsin, that's about 2,800 more people who have died than during an average year. Looking for anyone's comment on that as to sort of the effect this virus has had on the state.
Have you looked? That's a Harvard study, I think, right?
Yeah, no, I'm not familiar with the paper itself, but I think the national data suggests all cause mortality has been elevated because during the pandemic, and it's a combination of between cause deaths directly due to COVID-19. Potentially other explanations are deferral of care during the period where not a lot of medical care was being given in the same way, and people were nervous about going to the hospital for routine care or for emergency care. I think there's a lot more study that needs to have done to understand the mechanisms for that. But it hasn't just been deaths due to the virus. It's a good point, but I haven't read the study or the paper yet.
Thank you, Sophie. Now to Denise Lockwood from Racine County Eye. Denise?
Thanks for taking the call. As I'm looking at the dashboards you guys have on the race and ethnicity, I'm wondering, are Black and people of color, experiencing this virus differently, and how you're addressing that with allocating resources to those areas?
So I think one of the things that was really important from our perspective about adding that dashboard and that information to the website was to put it into some context, not only relative to their percentage of population in the state, but to give some more focus on what we know are underlying inequities that result in worse health outcomes, not just from COVID, but other diseases for people of color and our indigenous native populations. Right. What we know is that our health and well-being is inextricably linked to the safety of our neighborhoods, to poverty, to other factors that influence our ability to be healthy and well, and that those things that are outside of our control in many ways are disproportionately impact the people of color of this state and across the nation. It is why the governor has stood up a health equity council to help us focus on these issues, to help us focus on root causes and really put our shoulder against solutions that will help make sure that everyone in Wisconsin is able to live their best, healthiest and safest life. And so it was just a really important additional way for us to elevate these issues, for us to make that data available for folks to really understand what we're seeing here in Wisconsin and help us keep moving in the right direction to do the work we need to do to eliminate health disparities and health inequities here in Wisconsin.
Thank you, Denise. Now to Winnie Dortch from CBS 58 in Milwaukee. Winnie.
Hello. Thank you for taking my question. Just curious to know what's kind of like the age group, like the population that's been affected by the recent high numbers in death. Is it like old people, younger people, like certain race or populations affected? And why do you think so?
Yeah, we're seeing a pretty good spread across age groups. It's not particularly concentrated. I haven't looked at the graphs on the website today to see what our 3,400 today, how that's broken down. But that information is absolutely allocated across the charts and visualizations on the website. I don't know if you've had a chance to dig into them.
It's not one age group more than the other. Every age group has been increasing, not specifically at the same time. The group of 18 to 24 around early September was really leading the charge in terms of a very steep increase. They're no longer the highest rate of increase in new cases. Right now, all the other age groups have caught up. So right now, it's truly across the board. High disease activity level and an increasing trajectory in every age group that we measure.
Thank you, Winnie. Now to Julia McDonald from the New York Times. Julia?
Hi, can you hear me? Can you hear me okay? Thank you so much for speaking with us today. I'm wondering, so the field hospital has been described as an ultimate insurance policy. Does the fact that a patient was sent there signal that the situation has become even more dire? And I'm wondering if there's any information that you could give us about the circumstances surrounding the patient's arrival at the hospital.
So I'll let Deb weigh in on this. I think the alternate care facility is our ultimate insurance policy, right? It is the backstop for our healthcare system, for our hospital systems, should they breach capacity that doesn't allow them to care for the people that are in their care, and they need us to help fill that gap. They've worked very hard on their surge planning and on their ability and their work together across regions and across communities to share resources and share capacity as is necessary. But it's important for us to be there should they need us. But I'll ask Deb to weigh in more detail.
Secretary Palm, I echo your comments. Our hospitals are working very hard to optimize their capacity with the staffing resources that they have. They are working at being able to look at keeping those patients close to them in the community. But we also have to remember that hospitals aren't just caring for COVID-19 patients. They're caring for cardiac, they're caring for oncology, pulmonology, trauma, etc. So it's that pressure that the hospitals are having that they end up having conversations with us as they are trying to manage their bed capacity and their staffing resources. And that's where we come in, as Secretary Palm said, as the insurance policy, should they need us.
Thank you, Julia. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking the question. The head of the state Senate Health Committee said this week that there's really nothing more that state government can do with regard to addressing COVID-19. Governor Evers, do you believe that more could be done should the legislature choose to reconvene? And assuming that you do, what would be your three to five big priorities for you for further action to address the pandemic? Thank you.
Yeah, I just don't think it's, and I read that comment too, and it took my breath away a little bit. We just can't say, let's see what happens. That is not an appropriate response. And, I've asked for specific ideas from the Republicans, and, their response up until this point in time has been, a lawsuit here, a lawsuit there, criticism in public, and a lot of silence. And and frankly, that's one of the reasons we apparently lost in the Supreme Court the very first time, was that the Republicans said they had a plan. I haven't heard it. So again, I'm looking forward to getting some specifics from them, but I don't want to be a broken record, but there are basics at work, and I won't repeat them again. We need to get the rest of the state that is not complying to comply. We have our businesses are complying. There's lots of people that are complying individually that we just need to get over the hump so that all people comply and understand that it isn't about complying, it's about being safe and making sure that you're not infecting your neighbor or you're not being infected by them. And so it is, I won't dissuade anybody, or I won't try to argue anything other than those points. There may be science that comes up that we could add to the mix, but it's pretty basic stuff. I would like to also, and if we get a chance, maybe the legislators can think about, they sent a letter, several dozen of them, I believe, to the federal government early on in the pandemic saying, don't send us any money to the federal government. That letter went. And I'd like them to retract that. We need money. We need federal money. They can print it. We cannot. And our small businesses need it. Our farmers need it. Lots of people in the state need it. We need it to make sure we continue to do our good work. And I think having some official action on that piece would be very, very helpful.
Thank you, Eric. Now to Patrick Palaio-Antonio from WISN TV in Milwaukee. Patrick?
Yes, thank you. I have a question about hospitalizations and also the alternate care facility. So as the hospitalization rate goes up, what are you seeing with age groups of those hospitalized? Are they trending younger? And when it comes to the alternate care facility, is the effort to familiarize people with this type of model the reason why there's only one patient there right now? Thank you.
I guess I'll say a couple things, and then Deb and Dr. Westergaard can weigh in as well. I think, again, the alternate care facility is our insurance policy. It would be our preference, and it would be the preference of the hospitals that we be able to manage this disease at the local level in the communities where these families live, and not need this ultimate insurance policy. And it is the work that Safer at Home allowed us to do in this spring, was that surge planning, that work on the ground with the hospitals so that they could be making those plans, thinking through that stuff, figuring it out, and they are executing on those plans now. And so we should celebrate every patient that doesn't come to the alternate care facility because that means that we are managing this disease. It hopefully means that we are doing the things we need to do to stop transmission, that more folks are staying home, more folks are wearing face coverings, more folks are being super vigilant about physical distancing, and that we're doing that work together to allow our hospital systems and our frontline healthcare workers to provide the care that is needed in those hospitals, in those communities, and that the alternate care facility doesn't need to come into play in this response. But again, if we're needed, we want to be there for these hospitals, and it's why the work that Deb and her team is doing is so important. And Deb, I'll let you provide any additional commentary you'd like to.
Secretary Palm, you stated it beautifully. That was absolutely accurate. I will tell you that in the state of Wisconsin, we are truly blessed with an incredible healthcare system, with hospitals, leaders, everyone working on behalf of our residents here in Wisconsin during these very challenging times. Everything you said is spot on.
Thank you, Patrick. Now to Joe from WORT Radio in Madison. Joe?
Hi, thanks for taking my call. So my question is pretty much, so as we're kind of coming up to the holiday season, there's probably going to be an increase in cases and such. So what preparations are being made for Thanksgiving and other events coming up?
Well, we're encouraging people to stay at home and make sure that the people that they're with, the numbers are the immediate family. In my case, there will be Kathy Evers and Tony Evers, period. We have 3 children and 9 grandkids, and they are not in our immediate family, at least physically. And they're in our hearts, but not physically. And we're encouraging people to make the celebration small. I know that's a huge issue, but I'll go back to everything I said today, but summarize that there are preventable deaths that there are deaths we can prevent. Simple as that. If we can prevent deaths, we should prevent deaths. That should be a top priority.
Thank you, Joe. Now to Matt Piper from the Sheboygan Press. Matt?
Hi, yeah, thank you for taking this call. With contact tracers reporting that they're overwhelmed by the number of cases, is the state considering outsourcing any of these calls to private vendors or also alternatively using apps for contact tracing? And why or why not?
Yeah, so Matt, we are, everything is certainly on the table. As with this whole outbreak response, this whole pandemic response, we have changed and moved and adjusted and responded as the virus has continued to evolve throughout this pandemic. I think we at the state level continue to plus up our resources to be able to provide surge and backup to local public health departments. But fundamentally, we should not be chasing this disease with contact tracers. We should be doing what we need to do to stop the spread and get to a place where our public health infrastructure is not so overwhelmed that it can't handle the number of new daily cases and the contact tracing that's required by those numbers. And those mitigation strategies are how we get Wisconsin back on the right track. They are staying at home. They are wearing a mask. They are vigilant physical distancing. They are the good hand hygiene and making safe choices to prevent, as the governor just said, to prevent unnecessary deaths and really do what we need to do to get us back to a place where we can manage this disease more effectively until there is a vaccine available for us.
Thank you, Matt. Now to Maddie Heim from the Appleton Post-Crescent. Maddie.
Hi, thanks for having this call. Just another question about the contact tracing. So given what you just said about, not chasing the disease with the contact tracers, I'm just curious, are you giving any thought to redeploying some of the $75 million that it looks like we've dedicated in the CARES Act funding to contact tracing, moving that around to any other tools to help stop the spread, given that tracers are a little bit limited, more limited now than they were before with effectiveness, or is that all going to still be used to keep hiring more tracers?
So we have been in working with local public health to on those contracts, because what we did, Maddie, was provided to local public health departments funding to hire contact tracers. We retained this surge capacity, this contact tracing surge capacity at the state level, which is the 285 folks we have driving towards 400. And so we have been talking to them about how many they've hired, how much of their money they've spent, what their other needs are, how we think about getting from here to the end of the year, considering that the money expires. Local jurisdictions have hired lots of contact tracers. And so the idea that they're not utilizing that money is not accurate. It is just a matter of the number of new daily cases outstripping the capacity of the workforce that we have plussed ourselves up to in anticipation of needing to do contact tracing. So they are all they continue to do this work. They have instituted a variety of strategies to make it more efficient, to prioritize the work, to do the disease investigations, like Dane County's announcement yesterday. But local jurisdictions have hired lots of contact tracers. They continue to do work in this space, and we continue to be in close contact with them about the CARES Act money that we have provided to them.
Thank you, Maddie. And our final question today belongs to NBC 15 in Madison. NBC 15? Okay, with that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.